Mr. Duckett was brought in to help with fixing our health care. They thought our health care was way over budget. They thought we were making, we were employing too many people. And to a point he was right in that management was top heavy, how we were using supplies and that we could have cut down a bit. A lot of areas we could have saved money at. But the one problem he had was I don't think he understood nursing and nursing care and families and how people needed health care. I felt that he maybe went overboard with his cutting and not really knowing what he was doing. Overboard to a point where he was wanting staff to come up with ideas on how we could cut back on our units. And we're like, we're already cut back. We can't cut back anymore. And it was almost like it was an overnight sensation with him where we were understaffed. And he comes along and tells us we have too many nurses. And it's like, how do you go from not having enough nurses one day to the next day you've got too many nurses? Part of our negotiations and contracts was that no, we are not overstaffed, we are understaffed. A lot of our nurses have left prior to the Klein years where he cut back as well, and we feel that a lot of these guys that took over, politicians in particular, didn't have a background in nursing or what was actually going on. And they just went ahead and cut without coming and saying, hey, or offering more positions, because there were nurses but there was no positions for them. They were casual and it wasn't keeping their families going, so a lot of them packed up and moved to the States. At the same time, prior to him coming, we had brought in a whole load of what they called Filipino nurses, international nurses. They came, they took over a lot of the LPN jobs because they weren't quite qualified for the RN, and he was ready to send them all back. And we're like, no, how can you do that to people? It was like we suddenly realized we were just a commodity to the politicians. And with Heather Smith fighting for us, we managed to keep many that were there. One of our contracts were that we wanted more nurses and we wanted younger ones that were to be given jobs to stay in Alberta.